Hello again. Today I'm going to talk about food allergies. We can go over the chapter here. So, food allergy is fairly common. When I was in training, I think we all kind of thumbed our nose at it and thought, this is a strange thing to talk about and not really of too much interest. But I became more and more interested in this topic and affected by it. Because a close relative developed a problem with food allergy, as I'll discuss, and as discussed in the chapter. At any rate, about 15 million Americans have food allergies, 4% of children and 1% of adults. Food intolerance, where you're not involving the immune system, is more common. That happens in 15 to 20% of patients, or 15 to 20% of the U.S. population. Milk and egg allergies have usually resolved in children by school age. Peanut allergy, unfortunately, tends to hang around. Only about 20% of those resolve by adulthood. There is a recommendation to introduce peanuts at age 4 to 6 months, unless the child is considered to be high risk. There's a recommendation to avoid strawberries until the child is 6 to 9 months, being careful to give soft strawberries that are cut up so you don't get airway obstruction. Honey, whether raw or regular, should be avoided until the child is 1 year of age due to infant botulism. It's important to recognize that food allergy really involves the immune system and antibodies and other immune reactions to food. For instance, lactose intolerance is fairly common, as I've discussed in a previous chapter, and does not involve the immune system at all. It just has to do with how you metabolize and digest certain foods. The most common food allergens are milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. Spice allergy is uncommon, representing only about 2% of food allergies. Spice allergies are more common in certain spices, and those are listed in the chapter. The immune system is very complicated. It is run mostly by white blood cells called lymphocytes. The white blood cells also include neutrophils. There are basophils, eosinophils that are involved as well. There's a cellular immune system and an antibody immune system. Lymphocytes differentiate into T cells, which are cells that are involved in cellular immunity, and oftentimes these are delayed reactions. And then you have antibody producing lymphocytes that are differentiated from the B lymphocyte cell line. They become plasma cells, is also the same name for the B lymphocytes. You can have immediate or delayed reaction. IgE antibodies or immunoglobulin E antibodies mediate immediate reactions, and they can be life-threatening. So in terms of the approach to therapeutics, a lot of times an allergist is involved with the evaluation and treatment, and elimination diet is put forth, and this usually involves those food allergens that I've mentioned that are the most common: milk, eggs, peanuts, tree nuts, soy, wheat, fish, and shellfish. So you eliminate all of that, and then if you're doing well after you eliminate those, then they're added back one at a time to try and discern which food is the problem. There are also blood tests. These are usually IgE antibody testing of specific food substances. And there's also skin tests, which are used in the allergist's office to determine what the culprit is. Now, there's also a number of other tests which are of questionable value, and there's a lot of, cowboying types of allergists that are around that are doing all kinds of tests and all kinds of things. So you want to make sure that the allergist that you see, if you're going to see one, is one that's recommended by your doctor and is not just doing all kinds of tests that really are not helpful. There's a subset of food allergy known as oral allergy syndrome. This is a syndrome that involves the throat and mouth, and you get some swelling in this area, and it usually is raw foods. Once those foods are cooked, you don't tend to get that syndrome. If it involves more than the throat area or the mouth area and is not a localized reaction, then it's no longer oral allergy syndrome by definition. I'll also say that celiac sprue is not IgE, it's more IgA and IgG mediated and involves the small intestinal lining. There are antibodies there. Wheat allergy is a different type of entity and involves IgE antibodies. So you have to think of those differently. There are various syndromes and collections of allergies, such as birch allergy, which involves apples, pears, raw potatoes, carrots, celery, hazelnut, kiwi. There's ragweed allergy that could also involve melons and bananas. Celery, mugwort, birch spice syndrome, latex fruit syndrome, so forth. These are all outlined in the chapter on food allergy. Things that can make allergic reactions worse include viral infection, alcohol intake, emotional stress, menstrual periods. For severe reactions, you want to make sure you have an auto-injector of epinephrine that you can always get to in a hurry. There is a relatively new food allergy described called alpha-gal syndrome. This has to do with an allergy to oligosaccharides on the cells of non-primate animals. Mostly manifests as abdominal pain, nausea, vomiting, diarrhea after eating red meat, including beef, lamb, and pork. Sometimes gelatin or milk or dairy products as well. Thought to be something that develops after a tick or parasite infection. The Lone Star tick has been the most common mediator, seems to trigger this particular food allergy. The CDC.com is a good source of information for this particular syndrome. There is more information in the chapter, but that is really kind of an overview of the food allergy chapter. And that's all I'm going to say on food allergy.